This might change how you think about breast cancer. Breast cancer doesn't only affect women. Men can get it too. Yes, you heard that right. While women are far more likely to be diagnosed, men also have breast tissue, which means they're not immune. And that's why today's conversation is for everyone, men and women alike. Breast cancer is one of the most common cancers in the world. In fact, it's estimated that 1 in 8 women will develop it in their lifetime, and thousands of men are diagnosed every single year too. But despite how common it is, there are still so many myths, fears, and questions surrounding this disease. And understanding it, even just the basics, can save lives. In today's video, we're diving into the topic of breast cancer, what it is, how it develops, and why early detection is absolutely crucial. We'll talk about the early warning signs you should never ignore, the risk factors that could increase your chances, and the screening tests that might just make the difference between catching it early or too late. We'll also explore how breast cancer is treated today, some of the exciting new breakthroughs in medicine, and what life looks like after a diagnosis, because survivorship is a story worth sharing too. So stay with me as we uncover the facts, break the myths, and empower you with everything you need to know about breast cancer. Before we continue, don't forget to like, share, and subscribe, because spreading awareness could help someone else catch breast cancer early and save their life. Let's begin. Now let's talk about early detection and screening. Early detection is the most powerful tool we have in the fight against breast cancer. When breast cancer is found early before it has spread, the chance of successful treatment is incredibly high, often above 90 to 99%. That's why understanding how to screen, check, and detect early signs is absolutely essential for everyone. Let's explore the key steps to catch breast cancer early, starting with what you can do right at home. One of the simplest and most effective ways to stay alert is by performing a monthly breast self-exam. This isn't complicated. It just means getting familiar with how your breasts normally look and feel so you can notice changes quickly. Here's how. Step 1. Stand in front of a mirror with your shoulders straight and arms on your hips. Look for any changes in size, shape, or symmetry, and check the skin for dimpling, puckering, redness, or scaling. Step 2. Raise your arms and look again, checking for changes in the same way. Step 3. While lying down, use the pads of your fingers to gently press your breast in circular motions, covering the entire area, from your collarbone down to your ribs and from your sternum to your armpit. Step 4. Repeat this while standing, such as in the shower, when skin is slippery and changes might be easier to feel. If you notice a lump, thickened tissue, discharge, or any unusual change, don't panic. Most changes are benign, but contact your doctor immediately for further evaluation. Self-exams are important, but they're not a replacement for professional screening. A clinical breast exam is performed by a healthcare provider who's trained to detect abnormalities you might miss. From your 20s to 30s, it's generally recommended to have a clinical exam every 1 to 3 years. Once you're 40 or older, you should aim for an exam at least once a year. These checkups are quick, painless, and can often detect subtle changes that might signal something worth investigating further. Next is the most effective screening tool we have, the mammogram. A mammogram is a low-dose X-ray that can detect tumors years before they become large enough to feel. Here's what you need to know. Most women should begin regular mammograms at age 40 and continue every 1 to 2 years. If you have a family history of breast cancer, you may need to start screening as early as 30 or even younger, depending on your doctor's advice. Mammograms can detect changes that are too small to notice through self-exams or clinical exams, and that early detection can be life-saving. For people at higher risk, such as those with BRCA1 or BRCA2 genetic mutations or a strong family history, doctors may recommend breast MRI or ultrasound in addition to mammograms. These advanced imaging tools provide more detailed views and improve the chances of catching cancer even earlier. Remember, early detection isn't about fear. It's about empowerment. A monthly self-exam, regular checkups, and scheduled mammograms could mean the difference between catching breast cancer early and fighting it late. Take charge of your health today, because spotting breast cancer early could save your life. Let's talk about the risk factors and prevention. Breast cancer doesn't happen overnight, and while no one can control every factor, understanding what raises your risk is the first step to prevention. Some risks you can't change, like your age or family history, but many others are in your hands. Let's break them down and talk about what you can do to protect yourself. First, let's talk about the main risk factors linked to breast cancer. Age. Most breast cancers are diagnosed in women over 50, but risk begins increasing in your 40s. Family history and genetics. Having a close relative, like a mother, sister, or daughter, with breast cancer or carrying BRCA1 or BRCA2 gene mutations, raises your risk significantly. Hormonal factors. Early menstruation before 12 or late menopause after 55 means longer exposure to estrogen, which can slightly increase risk. Reproductive history. Not having children, having your first child after 30, or not breastfeeding may also raise your chances. Lifestyle factors. Lack of exercise, being overweight, especially after menopause, drinking alcohol, smoking, and a poor diet all increase your risk. Radiation exposure. Past chest radiation, for example, during treatment for another condition, can also raise your risk. Knowing these risk factors isn't about fear, it's about awareness, so you can take action where it matters most. While you can't change your age or family history, there's a lot you can do to lower your risk. Stay active. Aim for at least 150 minutes of moderate exercise each week. Maintain a healthy weight, especially after menopause, when weight gain is closely linked to increased risk. Limit alcohol. Even small amounts raise breast cancer risk. The less you drink, the better. Quit smoking. Tobacco not only increases risk, but also affects overall treatment outcomes. Eat smart. A diet rich in fruits, vegetables, whole grains, and lean protein helps your body fight inflammation and cancer growth. Breastfeed if possible. It offers protection for both mother and child. Get regular screenings. Mammograms and clinical exams help detect changes early when treatment is most effective. For those with a strong family history or genetic risk, talk to your doctor about genetic testing or preventive medications. In some high-risk cases, preventive surgery is even considered. Understanding your risk empowers you to take control. Small, consistent lifestyle choices, combined with regular screening, can dramatically reduce your chances of developing breast cancer. Prevention starts today, and every healthy step you take matters. Okay, let's talk about the newest advances in breast cancer treatment that are transforming patient outcomes. First, targeted therapies. Drugs like trastuzumab deruxtecan target HER2 positive tumors with incredible precision, attacking cancer cells while sparing healthy tissue. For patients, this means stronger results with fewer side effects. Second, immunotherapy. Treatments like checkpoint inhibitors are showing real promise for triple-negative breast cancer, activating the immune system to identify and destroy cancer cells that were previously invisible. Third, personalized medicine. Tumor genetic profiling is now guiding treatment. Doctors can select drugs based on specific mutations, like PIK3CA or BRCA mutations, increasing effectiveness and reducing unnecessary treatments. Fourth, PRP inhibitors are a breakthrough for patients with DNA repair defects. By blocking cancer cells' ability to fix themselves, these drugs slow progression and improve survival rates. Fifth, combination therapies are redefining care. Pairing targeted therapy with immunotherapy or hormone therapy creates a multi-pronged attack, especially for aggressive or resistant cancers. Surgical and radiation advances are also critical. Oncoplastic surgery preserves appearance while removing tumors, and precision radiation limits damage to healthy tissue, speeding recovery. The bottom line is, these advances are making breast cancer more treatable than ever. The earlier the detection and the smarter the therapy, the better the outcome. Breast cancer treatments are evolving. Talk to your doctor about the latest options today. Next is living with cancer or life after treatment. This can feel overwhelming, but it's important to know you're not alone. Let's go straight into what this journey looks like and how to navigate it. First, managing physical health. Treatment side effects like fatigue, nausea, or pain are real, but modern therapies, medications, and lifestyle adjustments can help. Regular exercise, a balanced diet, and proper sleep are crucial in supporting recovery and overall well-being. Second, mental and emotional health. Anxiety, fear, and depression are common. Speaking with a counselor, joining a support group, or even sharing experiences with loved ones can make a huge difference. Mindfulness practices and meditation also help many patients cope day to day. Third, staying on top of follow-up care. Post-treatment checkups are essential. Scans, blood tests, and consultations help detect recurrence early and ensure your body is healing as it should. Keep a clear record of your treatments and symptoms. It empowers you and your healthcare team. Fourth, rebuilding life. Returning to work, hobbies, and social activities can feel challenging, but small steps matter. Set realistic goals and celebrate every milestone. It's part of regaining normalcy and confidence. Fifth, long-term health planning. Cancer survivors may have increased risk for other conditions, so preventive care, vaccination, and screenings are vital. Ask your doctor about lifestyle changes, supplements, or therapies that can reduce long-term risks. Finally, remember, life after cancer is possible, meaningful, and full of hope. Each day is an opportunity to reclaim your health, nurture your relationships, and focus on what brings you joy. Living with or after cancer is a journey, but you don't have to walk it alone. Reach out, stay informed, and keep moving forward. Now, let's talk about the aggressive/rare types and special cases. While most breast cancers are treatable, some types are aggressive, rare, or behave differently, requiring special attention. Let's dive straight into these cases. First, triple-negative breast cancer, or TNBC. This form lacks estrogen, progesterone, and HER2 receptors, making it unresponsive to hormone or HER2 targeted therapies. TNBC tends to grow faster and spread more quickly, but recent advances in immunotherapy and targeted drugs are improving outcomes. Next, inflammatory breast cancer. This rare type causes redness, swelling, and skin changes instead of a distinct lump. It's aggressive and often diagnosed at a later stage, but early chemotherapy, surgery, and radiation can still make a difference. Cut to animation of lobular breast cancer cells. Then there's lobular breast cancer, which starts in the milk-producing lobules. It can be harder to detect on imaging and sometimes spreads differently, requiring careful monitoring and personalized treatment strategies. Some aggressive cases are HER2 positive. While they grow quickly, targeted therapies like trastuzumab, pertuzumab, and antibody-drug conjugates have significantly improved survival rates, even in high-risk patients. Special cases also include cancers related to genetic mutations, like BRCA1 or BRCA2. These may appear at a younger age, or in both breasts. For these patients, treatment may include genetic counseling, preventive surgery, or specialized drug therapy. The key takeaway: aggressive and rare breast cancers require early detection, tailored treatment, and careful follow-up. Advances in targeted therapy, immunotherapy, and personalized medicine are giving patients with these challenging cancers a real chance at long-term survival. Aggressive and rare breast cancers are tough, but new treatments are giving hope. Talk to your doctor about options tailored to you. Breast cancer touches millions of lives, but there is hope. Advances in early detection, treatments, and personalized care are giving patients stronger chances than ever. Listening to your body, getting regular screenings, and understanding your risks can make a life-saving difference. The journey may be tough, but with support, knowledge, and timely action, survivors are not just surviving, they are thriving. Remember, awareness and early detection save lives, and every step you take counts. Take charge today. Schedule your screening, perform regular self-exams, talk to your doctor about your risks, and share this message because early action can save a life.